Right. So vascular surgery self-scoring. So vascular surgery self-scoring has changed, but not a lot from last year. But we'll go through each element of the vascular scoring. So self-assessment scoring. So what they have mentioned, the new thing is they would include the achievements in terms of publication, presentations, audits, and all that portfolio from within last 10 years. If obviously you do not have more than 10 years experience anyway, it doesn't matter. But if your experience has been more than 10 years, then they will include only the achievements in the last 10 years. And the 10 years counted from December 11th, 2025. The other thing they mention is if there is a achievement, for example, you've done a research, published it, presented it as well, then you can put that in both publication as well as presentation. But something not accepted yet, what they say is not completed achievements at the time of submission. So they recommend not to submit. But what I would say is if you expect publication to be, let's say, for example, accepted, or you are due to present, let's say, on December 15th, then I would say do submit that because you will have the evidence of presentation before your evidence upload window closes. So there is a chance it would be accepted. There is a chance it may not be if they look into detail, but the scoring is very subjective, and there is 80% chance that if your presentation is before the evidence upload deadline, do include that at the time of application. And then at the time of evidence, you will have the evidence and you can upload the evidence. So maximum total self-assessment score is 39. No hard cutoff. It depends what the people score, and they will take top candidates to invite for the evidence and then top 96 to invite for the interview. The interview capacity is 96. This is the weightage of each descriptor. Surprisingly, the weightage of additional qualification, leadership, teaching has gone down remarkably. All these three things combined are still more or less equal to presentations and still less than total vascular surgery experience. So they have changed the weightage. They have removed specialty rotation experience. They have removed total experience, and they count only the vascular surgery experience this year along with the other components. And they have given that a significant weightage. So what they have done is if you have an experience of up to 16 months in vascular surgery, then you get the maximum score. But if it is more than 2 years, you will not get any score in this domain of the self-assessment. That does not mean that you cannot apply. You can still apply, but your score in this domain has gone down. But because you have more experience, there is a good chance that you will have more presentations, publications, audits, and everything. So you will be disadvantaged due to experience, but you will be advantaged at some point. And the people who have lesser experience, they will have from 4 to 16 months, they will have the maximum score, and they need to stay on top of other elements of the portfolio as well to qualify for the interview. It's very self-explanatory, but what important is do not include specialty rotations in that. If your vascular cover was only emergency vascular cover, but actual rotation was general surgery, technically speaking, it's not vascular surgery. But what I would say is look into your experience and find out what helps you. If you can get the certificate of that experience in vascular and it helps you, then probably you can do that. In vascular surgery, they are not that strict as in general surgery. So you can potentially do that. And if it's not helping you, and if it helps you that you stay in general surgery, I mean, your experience stays in general surgery, then probably do that. Full-time equivalent, if you are half, partly research or less than full-time due to other reasons, then see how that helps you. You can exclude the long sickness or maternity leaves. And the last point I mentioned already, if you are covering both vascular and general, see what helps, what gives you more advantage. And in vascular, they are not that strict, and probably you can use it in your advantage. Surgical experience. In vascular surgery, what they look at is both appendectomy and femoral artery explorations. And out of these two, whatever gives you more score will be counted. Let's take an example. Somebody has done 60 appendectomies, but they have done 12 femoral explorations, for example. So they are getting 4 score based upon appendectomies, but 3 score based upon femoral explorations. So they are advantaged and they will have 4 score based upon appendectomies. But there is somebody else, for example, they have done 18 femoral explorations, but they have a lot general surgery experience and they have done 120 appendectomies, just example. In that case, from femoral exploration point of view, they are getting 4 score, and appendectomy point of view, they are getting 1. So for the scoring system, they will get 4 score. So it will work in your advantage. So find out how many explorations you have and how many appendectomies you have and what score you get. And femoral exploration means even if it's a fem below knee, fem above knee bypass, and you were involved in femoral exploration, that counts. If it was a femoral endarterectomy, it counts. So if it was fem-fem crossover, it counts. So any kind of femoral exploration, part of the operation being femoral exploration counts. But you got to put it in the logbook under those operations. What I normally recommend is if your logbook is not from UK, then it's the time to transfer your logbooks to the UK logbook because multiple logbooks do create confusion. If you consolidate into a single logbook, that helps clarify the things. Even if your supervisors are not in UK, they can be put into elogbook.uk and then you can put the cases in there. And you can get the consolidated sheet signed. And in vascular, generally, it's been seen that consolidated sheet is generally enough. It's a different case for general surgery. There, I recommend that you probably submit individual pages, but for the vascular, consolidated sheet is enough. Ria has raised hand. Yes, Ria.
Hi, thank you for giving this talk. I just had a question about the femoral explorations that you were describing there. If it's a component of the operation, for example, if you have femoral endarterectomies and femoral distal bypasses, the consultants who are scoring our applications, are they going to look through all of those and include them in the femoral explorations? Because there is a category for specifically femoral dissection or exploration that comes up on the consolidation report, which is quite clear cut. You're able to figure out exactly how many the candidate has done at STS level or above. But then all of those other procedures, you have to kind of go fishing for them in the list of parts of an operation. So do the consultants that are looking through your application, do they do that or do you have to highlight it for them?
You will have to. So this is the understanding, because this was the issue last year, and now there's a current understanding that all these procedures are counted as femoral exploration. But for example, you were involved in a bypass, let's say for example, above knee popliteal bypass or something like that, but you were involved only in the below, like a popliteal exploration, or you were involved in femoral exploration, but your involvement was kind of assistance, then it's not counted. So it all depends how you have put it in your logbook. Many candidates from the last 2 years, they changed the way they used to put in the logbook, keeping in mind this femoral exploration. And they normally put the femoral exploration separately, which is fine. But current understanding is that femoral endarterectomy, fem-fem crossover, fem distal bypasses, they are part of the femoral exploration procedures.
Thank you.
So domain number 3, first author publications. It's not very complex for the vascular surgery applications. So what they ask for is your best at least 4 first author publications. They need to be PubMed indexed. And once it's PubMed indexed and it's a true paper, it's not a case report or abstract or letter or technical tips, it's a original paper, then that's it. You don't need to worry about the quality of presentation and all that. So you submit 4 presentations, you will get 4 marks if they are PubMed indexed. That's very simple, straightforward. Same is true for other author publications, like a second onward authors, and you can submit up to 5 publications and you will get the 5 marks. They have to be PubMed indexed. What I recommend in the publications is, let's say you have a publication which is not PubMed indexed, but you do not have enough PubMed indexed publications otherwise, then I would say submit that non-PubMed index publication as well. There is no negative marking, but there is a chance it would be accepted, and it has happened in past. Despite this saying PubMed index journals, it's a gray area. They ask for PMID. You may not be able to submit PMID. You may submit DOI of the publication. There's a chance it may not be accepted, but there's a chance it may be accepted. But if you have the PubMed index publications, do submit those in preference to non-PubMed index publications. They changed slightly in presentation this year. They are asking for last 2 years whole time equivalent. Excuse me. They're asking for in the last 2 years your national and international presentations. So if it is more than 2 years, it will not be counted. But they will not exactly count the years. Even if it's within 2.5 years, I would say do submit if you do not have within 2 years. And more you submit, more score you get, up to a maximum of 6. But any regional or local presentations are excluded. Poster presentations are excluded. So they only include oral presentation. If it is an oral presentation in a virtual conference or you presented remotely, it's accepted. So virtual presentations count. Talking posters, gray area. If you have something else, prefer that. Otherwise, submit that and there is a chance it may be. Posters not counted. Audits, they have changed the criteria, made it little complex. What they are asking for is 3 audits. 2 of them should be closed loop, and third one can be non-closed loop, and it can be QIP, like a quality improvement project. They will not look into details of the quality of audit. I'm comparing it with the general surgery, where they say that the regular mandatory audits, like a VT prophylaxis and in fact the antibiotic stewardship audits, they are excluded, but they are not excluded in vascular surgery. And they are not looking into detail, but what they are looking at, full cycle and your involvement. Audit certificate only is not sufficient to prove your involvement in each cycle of the audit. So you need to get a letter from your supervisor that details your involvement in planning, execution, data collection, interpretation, presentations, intervention, and then second phase, the similar involvement. So you must get a letter if you want your audit to be counted. If you have 3 closed loop audits, submit 3, and there's a good chance you will get the score. But make sure you submit a good evidence of your involvement into the audit. So that's the details they mention. Scored against following criteria. Only submit audit or QIP which have been presented, as you will need to provide evidence of presentation. For each loop of closed loop audit or for additional QIP, you must provide evidence of your involvement in design, execution, and presentation. And that's not through a certificate. I recommend you get a letter. They don't say that, but I have seen candidates getting their audit certificates, not enough evidence to prove that their involvement. So do get a letter. Applicants should note that to qualify as a closed loop audit, there must be a clear evidence of applicant on both. So they have stressed a lot onto that. Audit tips. What I normally say is, in your audit, whatever is the positive aspect of your audit, do highlight that. It does not matter too much because here it's yes or no. In general surgery, it matters more. But if you highlight your positive aspects of your audit and your involvement, there's a good chance that it will not be rejected and it will count toward your score. Change in practice is the point. That's the most heavy point in any audit. Additional qualifications. So in vascular surgery, even your previous fellowships in other countries or your masters, they can be counted even if they were done as part of the training. They may not be, because in the general guidance they say intercalated degrees are not counted. But if you presented XYZ numbers of years research involvement, you put your thesis, there's a good chance it would be counted. And then depending upon number of years, you will get either a master's if 2 years or PhD MD depending upon 3 or 4 years. But PhD MD scoring is maximum score is 3 in this category. But what I would say is, though they say that eukaryotic is up to their discretion to accept it, but generally eukaryotic equivalence is generally accepted. So you can get your equivalence certificate. If you don't, that's still okay, but do mention number of years, transcript, dissertation, thesis. Leadership management. So if you have a formal leadership role, then you will get the 2 score. For example, formal leadership role means like on a Rulio club, you have some leadership, or in any other society, you are named part of the organization, then yes, it's a formal leadership. Otherwise, if you have informal leadership, for example, or management of the rotas or management of organization of certain meetings or conferences, so that counts as informal. So find out some certificates, even if you do not have anything at the moment, but you can look into your past and get the certificate for at least local level leadership. National level, ST3 Club, organization of the international meetings or the sessions. But local level, MDT coordinator, junior doctor, teaching organizer, rota coordinator, discharge coordinator. There are many roles you can take. So don't miss that one single mark, though it doesn't look on the paper a lot, but one single mark can make a difference. Teaching. So if you have a formal teaching role, like a clinical lecturer or repeated teaching sessions for the medical students, then you get 2 score. If not a formal teaching role, but you can put the evidence in terms of feedback from the either the students or the junior doctors, then you will get 1 mark. So that comes under substantial involvement. They say that they do not consider any more train the trainer course, but if somebody has done it along with some teaching evidence, there's a good chance they will at least get 1 score. Any degree in teaching is not counted in teaching experience anymore, but it is counted in additional qualifications. That's what I explained already. If you have a formal, some university or Royal College role, then you will get 2 score. Otherwise, informal qualifications, along with teaching experience, you will get 1 score. Train the trainer we mentioned. Evidence of formal teaching, but make sure you get feedback forms, letter of appreciation, or the certificates. If you are, for example, ATLS instructor, this is a formal teaching role. Lecturer appointment, teaching regularly on recognized courses, CGRIS, ATLS, BSS. So it's should come as a formal teaching role. What does not contribute anymore is the total clinical experience. Rotations, they have excluded this year. Work-based assessments, courses, awards, prizes, they do not contribute to the self-assessment anymore. Just a brief about the interview, but you should not focus on the interview just at this point in time. Focus on the application, go through the self-scoring properly, and then start working on the interview. But the interview would be online, it should say 2026. There are generally 4 stations grouped 2 and 2: clinical and management, portfolio. No, sorry, portfolio was excluded, so it's an old one. Communication and virtual skills. There is no portfolio station in vascular surgery. Further resources, you can look into our website. Applicant guide for 2026, person specifications, they are available on HE website. And health education England website itself has significant information material. This is the snapshot from our website. This is the Facebook group. If you're not already part of the ST3 Facebook group, then I highly recommend you join it. I will paste the link into the chat. The Facebook group helps in a way that there are previous successful candidates who can contribute and add to your queries, and you can find the buddy partners for the preparation. Furthermore, we do run the interview preparation courses for both general and vascular surgery, and the courses are now live. They were scheduled to be live tomorrow, but I have asked them to make them live today. I will paste the link, and these courses do involve the lectures as well as the mock interviews. Places are generally limited to 24 to make sure that there is a 2-to-1 faculty ratio. So if you are keen, I recommend you book it sooner than later. There's a question bank. If you is not the last year updates are not there yet, but they are scheduled to be updated by the end of next week. If you book the course, the question bank is complimentary. You will get the details. And if you are already a question bank member, then if you log into your account, your question bank price will be deducted from the course and you will be able to book the course as a lower price. That brings us to the questions. Let me look into the questions in the chat. Right. Okay, looking into the questions. My employment letter says Department of Surgery only. It says vascular and general surgery. So that's very generic. That may go against you because they may count your experience more than uh, 18 months or even more than 5 years. So if you can get specific vascular surgery experience certificate, then probably that would be helpful, because any ambiguous thing will not go in your favor, unfortunately. So make sure you clarify separately what date was general surgery and what date was vascular surgery. Any idea what short listing self-assessment score is this year? This year is not done yet, but last year, uh, I'm not sure actually, but generally if you have 20 plus, you do get the interview invite. I think it was 19. Yeah. Sorry, the network is too bad. Oh, sorry. Was my voice breaking? If there is any queries, do let me know. Otherwise, the video recording will be uploaded as well. I have been working in vascular surgery department since 21 after completing master's degree, but has worked in this department before post graduation for 3 years. How will this count? Ah. So sounds like both your pre-graduation and post-graduation experience is in vascular surgery. So the time of graduation, if it's not a medical college graduation, the graduation, if I understand you mean the post-grad, like a vascular surgery graduation. So it doesn't matter for the experience. So after internship, all the experience in vascular surgery is counted as a single vascular surgery experience. Sorry, I have asked the question earlier on as well, but I had to leave as I thought it was for general earlier. I have 9 score with the new system, so I stand a chance. Well, 9 score is not a lot, but criteria has changed and they have disadvantaged a lot vascular experience this time. So maybe the overall score may come down. So, but what I would say is do apply and hope for the best to give your best attempt. Also, does it help you if you are a late? No, it doesn't. So it doesn't matter. They will not see if you are a late or not. But it would help you if you get it. You can skip your ST3 years. How to add femoral and artery exploration in the e-logbook, as there is a no clear index procedure and says femoral artery exploration or dissection. So as I mentioned, femoral endarterectomy, fembil distal bypass, fem-fem crossover, everything together comes under femoral exploration. If I have the same topic presented more than once or twice, calculate a 1 or 2, 1. So same thing twice is not calculated. For the presentation, if it's a collaboration that I'm involved, is that accepted? Presentation, no, presentation has to be you presented. But if you are presenting, I understand somebody is also presenting the part of the presentation, I would say it should be accepted because you are presenting. And but you should show the evidence that your name is in the presenters. Is the third audit is the third audit is okay to be no second lobe? Yes. So if the third audit is not a second lobe, then it will get 1 score, provided your involvement and presentation of the first cycle. And what is the criteria for the third audit? It's the same. The audit, either it can be audit or quality improvement project. If one has both master's and PG certification, will that be 3 marks? No, the highest will be counted. For the leadership, can it be something year ago? Yes, it can be. If postgraduate student representative at University of Edinburgh, would this count as a national or regional? Representing at University of Edinburgh, uh, it is regional, but should get a regional score though. How can you make it national? No, it's a university level leadership. So yeah, it should count as a regional. What evidence need to submit for teaching evidence? The best evidence is the feedbacks. So what I would say is informal teaching without feedback is nothing. So must have a feedback. But if you have a formal teaching, then the certificate or your contract, for example, clinical lectureship, or your certificate from a university that you have been a lecturer for the university or clinical lecturership. If teaching medical students on the ward, would that count? Well, it doesn't, but if you regularly teach them and you get the feedback forms, then you stand a bit of a chance. But regular teachings on the ward doesn't. Few questions, sorry for the long message. Is a letter from the HR department with start and end date of service acceptable in domain 1? Yes, that's what the criteria is, but it should mention your specialty as well. Whether it was general surgery, vascular, hepatobiliary, or what. For oral presentation domain, I have a project presented at a national meeting, but not presented by me. The organization did not provide a certificate for all the authors of the project, but only for the presenter. Can I use that presentation certificate as evidence, or can I use the acceptance email sent to the presenter? Well, what I understand is, let me look at that in detail, but in vascular surgery, you probably need to present to qualify into the presentation. But does anybody else know if it's otherwise? Let me see what it says in the presentation.
The reason I asked that question is because I think the wording, specific wording for the self-assessment domain says work that presentations of work that you have been a part of.
Oh yeah. That reminds me. Yeah. So that what I was thinking. There was something. So yes, in that case, it should count. So presentations have been given of work in which you are listed author. Yes. So in that case, yeah, even if you have not presented yourself, but you are a listed author, then yes, it should count. That's correct. Thanks for that's a very important point, and it can potentially
So,
help.
so in that case, does that mean that for works where you are named a collaborator, you could also include those because that's also an author?
Yes, if it's because when you send a abstract for presentation and they accept it, one thing is the email, second thing is their program mentions the title as well as all the authors, and as an evidence you can upload the meeting program. Actually, that is what they are asking. Please provide a copy of the relevant page of the meeting program. So if your name is there, just highlight that and submit that, and it should give you the score. So yes, does the leadership, sorry, what was it? Maybe I skipped something. Leadership and management. Can I use a certificate of acknowledgement for involvement in the organization and conduct of a national regional surgical skills competition as evidence? Surgical skill competition may not give you a leadership, but can I use a certificate of acknowledgement for involvement in organization? Yeah, if you organized that competition, then it may give you. at least local level. So if you don't have anything, it's worth trying. You will not have a negative marks. So does the achievement being used? Don't get what that means. Does the achievement being used? No. Would you clarify that? In the meantime, I will. Can I confirm that if I want both general and vascular surgery course, will there be a discount? Just drop an email and they can offer you some discount. I hope so, yeah. So I had 2-year experience of cardiovascular and thoracic together for 2 years. Cardiovascular and thoracic, okay. I have supplied in the last year's application evidence for 8-month vascular out of it, roughly. Can I just remove that this year and provide as cardiothoracic? Would they check last? No, they will not check last year evidence. They will not have access to that. So you can put the whole 2 years as cardio if that's helping you. In Egypt, vascular surgery is not separated from the general, and many letters say vascular and general surgery department. So unfortunately, that would be counted as a whole vascular, and that I think, may disadvantage you because that will go way above the marking. Try and ask some of the consultants to give you a kind of a certificate that mentions from this date to this general, this date to this vascular. So you just need to show them the evidence. On the self-assessment, they match appendectomy side by side with the family. If someone have 50 to 90 appendectomy, family 40, what do you suggest? See picture below. What do you select? So you select the one that's giving you higher score, and that would be accepted. So this picture is I can't see. Let me see. But the guidance is that if family dissection is giving more score, the higher score. If the appendectomy is giving you more score, you get the. So yeah, in this picture it says appendectomy 1590 family exploration. So if that is in any of the criteria, if you are getting 4 score, you select that. It doesn't has to be both. My paper is pursued, but it's waiting for the PubMed. Yes, you can submit in that case. And submit the acceptance letter. I have a rotation in vascular at Aintree as part of my last rotation for CT2. Should I swap this so that I don't compromise on domain 1 score? Yes, if you can do that, yes. Does the achievement being used multiple domains include audits? Also, that is, can I use an audit that was presented locally and nationally for the audit domain as well as the presentation? Yes, you can do that, yeah. But not 2 presentations. So you can put single audit in the audit and same audit presentation in the presentation. I have a certificate from a UK university, which was a 60 credit professional skills certificate, but not a formal PG certificate. It was the first semester of a PG certificate, but offered as a detached program. Can I use this? It would not count as a PG certificate. So it would not count into additional degrees, no. I had a post in a private hospital in Egypt for 1 year, and the letter says surgery department, vascular and general surgery. So that's the issue. Probably you will need to get them a detailed kind of a experience letter or something. Otherwise, it will go against you. I had a survey on education. I was examined by a reflective piece, not a thesis or dissertation. So it depends how many months or years was it. If it was at least 1 year, then yes, it would count. But if it was less than 1 year, because PG certification, I'm not sure, it should be at least 6 months. So if it was less than that, there is a chance it will not be accepted in PG certification. Finishing this year as a LAT, okay, will give me 0 score of vascular experience. Will give me 0, but I don't finish my lat year, I get 8 score. Is it worth quitting or stopping? I don't get. Finishing this year as lat will give me 0 score of vascular experience. So your lat, I presume, is a vascular. But I don't.
So I'm lat at the moment.
Mhm.
I'm lat at the moment, but if I finish this year, till next August, that means I'm overqualified, so I get a 0 score for the experience. But if I stop it now, that's going to make me less than 24 months.
So you will get how many scores?
8
4
scores
scores?
out of experience.
8. No. Let me go back again.
So it was less than 24 months.
So if it is less than 24 months, you will get 4 score. If it is 16 to 24 months, you get 4 score. And if it's 12 to 16 months, or actually 4 to 16 months, you will get 8 score.
Oh yeah, so it's going to be four
Yeah.
scores.
Yeah,
But now I
either
get 0.
4 or 8. Yeah. So you will get 4 score. So I think it's okay. I would say just continue. Or if you can change your rotation, maybe 6 months in something else. Is it possible in LAT? I'm not sure.
Well,
So
I haven't heard of that, but I may as well ask about it.
yeah, if you can change it as a rotation, maybe general surgery, then you may still keep 8 score. But otherwise, I
thank
would
you.
not recommend you quit it because you will struggle in many other things. How can single loop and quip help with audit section? No closed loop. You will get 1 mark. If I'm a secondary care hospital in Wales, does it count as 2 point? What does that mean? If I am a secondary care hospital in Wales, does it count as 2 points?
I
2
mean,
point.
I mean, if I am secondary care appraiser in Wales,
Oh, appraiser.
yes,
No, appraiser, you mean in the teaching?
appraisal. That one who do the appraisal for GMC and this is stuff. Appraisal for doctors.
Or formal appraiser?
Formal, yeah, appraisal.
I'm not sure which domain because it
Man
doesn't come under teaching.
management. I mean, in management and leadership.
Oh, management and leadership. No, still because it's not a leadership role. It's your achievement, obviously, but it's not qualify as you are leading a positive change. You are following a system which is fine, and it is your achievement. If you do not have anything else, then that's fine. You put it and see if they give you the score.
Yeah, you are
But
right. It is more management role rather than the leadership role.
leadership, yeah,
Management.
it's more of a management, but yeah, it is an achievement. If you do not have anything else, do put it.
Okay, one more question, please. Regarding that, I worked in Egypt in private hospital for 1 year in vascular and general surgery in the same department. And the letter says vascular and general surgery. How does it count for me?
Yeah,
Because
that's good.
I can't get a letter now from this hospital because I am now here in UK.
You cannot get it, is it?
Oh,
So if you cannot get it, then probably that will count. So it's not very clear, because if it says general and vascular, there's a good chance it would count as a vascular surgery.
for 1 year. So whatever, if they divided it by half, so it will count at the end of 6 months also.
I don't think they will count it half by half. Either they will put it in general or in vascular, and there's a good chance they will put it in vascular.
Okay, thank you.
So, but if you can get a specific letter with the dates, that would make it doesn't has to be a formal letter. Just ask one of the consultants to design a letter, sign it, and scan it for you.
Okay, thanks.
Someone who is a portfolio supervisor for the undergraduate medical students, can they serve the formal teaching at national level? Portfolio supervisor. It can be a teaching at a local level for undergraduate medical students, but probably not at national level. Okay, all right. So that brings us to the end of the vascular section as well. I think we have, oh yeah, we are half hour late. We started late anyway on the vascular. So any questions you have in future, do put on the vascular group, the Facebook group as well. You can get in touch with us via the email as well. And I'm on the Facebook group. There are many other people on the Facebook group, so we will contribute. And I wish you guys all the best, and hope to see you at some point, and stay in touch, and hope to see you as a colleague in future. So if there are no more questions, I will close the session now then. Thank you very much.